What are we doing?
Alright, so you gotta start in the groin, like up in there. Alright. So the first image is you want to see where the GSV is actually entering into the common femoral vein. If you come down a little bit, you can still see GSV. That's not what I want to see. I want to see it as the GSV is actually entering into the CFV. That's what you have to get in the real world clinical setting. That's an image that you have to get. Okay? And so you can do your dual screen. Like here, I'm going to try and fit in as much of the artery as I can, but don't cut off any of the vein because this is a venous study, not an arterial study. So here we'll show that. Come over here, compress completely. Make sure that you compress completely to where you see the walls are touching, okay? And then always make sure that you put your orientation, so this is transverse, and always put what side you're scanning. So I'm doing the right leg. Come up here, and for right now, I still want y'all to label exactly what vessel it is, just so I know that you know what you're looking at. Okay? And then over here, you don't have to do it again. You can just do A, and then compressed vein, and then the GSV is compressed too, so make sure that you annotate that it's compressed as well. All right? And then you can just stay in the same exact place, but turn your color Doppler on. And since we're in transverse, we want the box straight up and down. Straight up, oh, wrong one. All right, and you want your box just to be big enough to hold, or to have in it what needs to be in it. And what I noticed on some people's assignments is they were kind of coming straight down at it. See how that's not filling in very well, and when it does, this is red, and that's blue, and everything just looks backwards. Angle your probe upwards. Like if you're having your probe like this, angle it to where the sound beam is going up, because that's the way that the blood flow is going. So angle it up this way, and easy on your pressure, or else you can end up compressing the vein. So we just watch that normal, spontaneous, phasic flow, and there you go. Still, we would annotate the orientation, transverse, doing the right leg. Still come up here. This is, so our patient does not bifurcate early, so this is still CFA. On some people, or really like half the people, you'll see two arteries right here, and it'll be the SFA and the PFA. Okay, I'm still getting people trying to put CFA and then PFA. That's not right. All right, and then over here, we'd still want to label GSV and the CFV. Okay, and so that's your second image. And then from there, we just want to come down, and we're compressing as we're coming down, making sure that the vein closes all the way. And then this is our next image. We'll see the two arteries where they have bifurcated. This is SFA, PFA, and here's our CFV still. So we'd want to compress, and well, we do it on dual screen. All right, and then you can hit set, you can freeze, and then hit set to make the other side active, well, the R to make the other side active. And then we compress it. You can see the walls closing all the way right there. So that's your next image. And then from there, you keep compressing all the way down until you get away from the profundas. So now here's our proximal SFV. So we'd want to take our non-compressed image, compress, and there's the next image. And then you just do that same thing all the way down the leg. You're compressing every so often, making sure that that vein closes and that there's no blood clot in there. All right, all the way down the leg. And you'll do the same thing as far as like the taking the non-compressed image on this side of the screen and then the compressed image on this side. So then there you go. And you do the same thing for the pop. You're going to flip your probe around to where the notch is facing the bed. So you do like this, and normally you'll see the artery on the bottom and the vein on top now. So it's flipped normally, or usually. That's not always the case though. So then we'd want to do our dual screen as well for the pop vein. Okay? And then let's go ahead and turn on that pop vein, get it lengthened out. All right, put our color. You want to make sure that your color box is angled with the vessel. There we go. Alright, so then you'd want to get your color image. Oh, that's a lot. So if it's overflowing, you can turn the gain down, or if it's aliasing, you can turn the gain down even after it's frozen and take your image. And then for our pulse wave, you want to go ahead and get comfortable. Like if you come down, bring the machine down with you. It's kind of easier with doing the pop. You can just kind of rest your arm kind of on their calf. But let's bring it back in. So you'll come down and you'll just augment. Okay? And try and augment whenever they're breathing out, because then you'll get a stronger augment, and it'll wrap around the way it's supposed to. Okay, and then we'll come back up to the groin, get our CFV, get it lengthened out, put our color flow on there. This is a bigger vessel, so we're going to make our box bigger, and that's a lot of flow, so we need to turn that color gain down. Alright, and if we want to augment like this, we want to go ahead and get comfortable.
Augment on with your arm on this way.
No, you're gonna augment, but see, I'm just steadying my arm. I'm getting it like anchored somewhere. So where that way my hand's never moving. Because that was something that everyone struggles with, is trying not to move when you're augmenting. You have to anchor your arm down. Like I always would put it right here. Like this chair needs to go down though, or quad needs to go up one. But you always want to anchor that elbow right in between here. Okay, and then that way you can augment all that and you're never even moving your hand. Alright, and then it's the same augmentation down here as well. So there we get our grayscale. And we get, this is smaller vessel, so bring our color box down some. Alright, and I'm about to augment, so I'm going to get comfortable, get my arm anchored to where it's not going to move if I augment. Okay. So that's it. See, this hand never even moved because I had it anchored. And so I could just come right over and squeeze, and none of this ever moves. Okay, and then, so same thing, you do the same thing for prox, mid, distal, and the pop, all that's all the same. I'm going to go ahead and show y'all the anterior tibials real quick. So turn the leg in. The anterior tibials you'll find like in the little notch right here, if you feel, in between the fibula and that little muscle compartment there. You'll put the probe notch facing up. And then you'll see the anterior tibials look like they're kind of like diving down. And a lot of times you'll have to, well, on Quan's we can actually see his coming and diving down, but on a lot of like real world patients, you'll have to actually put the color Doppler on there to see. And so you'll see the two veins and the one artery, because everything below the knee and below the elbow too, whenever we get to upper extremities, you'll have two veins, one artery. So if we can get like a pretty one, I don't know, that might be the prettiest. We can see the two veins and then the one artery. That one you can still see where the artery is, and then the two veins. But that's the anterior tibial. And then posterior tibial, you're going to be getting those at the calf and at the ankle. So turn this back out. For the posterior tibials, we get those at like the medial calf. So just put your probe down. You usually get them kind of in this little crook right here. You'll feel like if you bring it up, it kind of stops at the shin bone right there. And then you can just angle your probe back and forth until you see them come in. Alright, and so here we can already see Quan's in grayscale. On some like larger patients in the real world, sometimes you can't see them unless you put color Doppler on there. So we're going to put color on, make sure that the vessel is angled, and then we're just going to augment, and I'm just going to kind of push down here by his ankle. And then that shows the two veins and the one artery. Alright, and then the same thing goes for, well actually, hang on, let me show you because I can probably see his. So we'll talk more about perineals, but those are just deeper to the posterior tibials. So sometimes you can see both of them in the same image. And we can see some of the perineals coming up down here, but there's an artery too. there's that artery trying to come in. Here, yeah, it's, here we go. So you see they're not quite as pretty as the posterior tibials, but they are just deep to the posterior tibials. Alright, and then the posterior tibials at the ankle, you just come right here, and they're going to be closer to the surface, so we're going to be looking up here now, because, I mean, the calf down here is a lot smaller than the ankle is smaller than the calf, so it's not going to be as deep down, so we need to decrease our depth. Let's angle our vessel and put our color on there. Alright, so there we have our artery. Quan's sock is getting in the way. Okay, let's go the other way. I like all my stuff kind of going in the same direction. I hate changing the box back and forth, but it's got these Nikes all in the way. You got to be very easy with your pressure, or you can compress the vein. I think I got all three in there nice and pretty. There's one of them. Able to get one down here right now, but basically you get the gist. If they did, well, this big old sock right here is probably compressing the veins, but either way you just get both of the veins in and it's fine. Okay, and that's it.
Thank you, Mrs. Crim. And